Good evening, good afternoon, and good morning, whatever time you may be watching this. Thank you for stopping by. And my name is Woody Collins, and this is another episode of Talking About Congo. And today's subject is COVID-19 vaccine hesitancy. And what that means is why are people so hesitant about getting the COVID vaccine? And I'm talking more about people in the Democratic Republic of the Congo. New article that came out today said that 28% of healthcare workers was hesitant about getting the vaccine. 28%. I mean, only 28% would get it. So therefore, that's 72%. Three out of four would not get the vaccine. So it just makes you think about what is going on. And that's not, there's vaccine hesitancy everywhere. So I want to make that perfectly clear. But in some of the countries, it is more alarming than others. And we've been talking about Congo having to give back 1.3 million doses of vaccines because they did not start their program to vaccinate their people. So when you think about that and think about three out of four people, healthcare workers in Pacific, would not take the vaccine, and you think, what is going on? And there was some hesitancy about whether the vaccine was safe. Okay. But then you look at what happened in Europe and they restarted it after looking at it again, but Congo did not. Second of all, there is a wide spread disinformation going on not only in Congo but throughout the world as to, is it real or is it not real? So when you look at the Congolese numbers, you can see why they are skeptical. If you don't have a robust testing and you don't see the deaths, because from my perspective personally, when I look at, how many people have died, how many people have been sick, and that is not just looking at what the television says, but looking at real life, knowing people who were sick, knowing people who died, knowing people who are not here anymore. That makes me think that and realize that it is real. But when you look at the numbers in the Congo, you think, okay, only 700 and some, not even 800 people have died. It makes you think, okay, yeah, this is not real. And then, some of the rumors going around is number one, that it is called by 5G uh, towers. And I'm thinking, okay, that's not really effective in the Congo, should not be effective, should not be an excuse because, gee, Congo don't even have 4G available in throughout the places. So they're talking about 5G. Mm, I wish I could see 5G in Congo. That would be something else. And we're talking about the internet speed. So, second of all, you're looking at uh, what is people saying that it's a mass conspiracy, that it's not, and it's just a way to test people, guinea pigs. And I'm thinking, yeah, if the Congolese saw what was really happening in the United States, it would make them think again, because there's more people in the United States that has been vaccinated, and that's real. And so why would you think that people in Congo are being vaccinated as guinea pigs when there's a lot more people in the US and around the world being vaccinated? So, you look at all these arguments, and each one of them have their mm, thoughts, and it's kind of like it doesn't really make sense. It doesn't hold water. But when people come up with excuses on why not to be vaccinated, it doesn't take much. But the bottom line on all that is, how effective is the vaccine program going to be in totally eliminating COVID-19 from Earth? We have been struggling for the last 20 years or more, close to, let's say, from the 50s until now. So it's close to 60 years with polio. Uh, and so you look at that and you think, but Congo did, get involved with the polio vaccine. But, when you look at the numbers and how long it takes, that's a long time. And that's a long time to be dealing with the pandemic. So that's all I had to kind of look at and think about and ponder. So that's going to be on my mind as I plan trips around the world, because there's not only Congo that is hesitant, there's other places that's really hesitant. They've stated that in Latin America, uh, there is a big hesitancy about the vaccine. So we'll see. Thank you for stopping by, and if you have anything to add to the conversation, please do. We appreciate your comments. Just drop them in the uh, comment section, and we will take a look at them, and we'll see whether there is something else to be considered. Thank you very much, and we will talk with you tomorrow. Take care, and as always, I'm a believer, so therefore, let's get this pandemic under control by washing our hands, wearing our masks, and socially distance ourselves. And like I did, get the vaccine. Take care now.